We're joined now by Dr. David Gray, an internal medicine physician at Austin Regional Clinic in Pflugerville. Dr. Gray, thank you so much for being with us tonight.
Oh, you're welcome. My pleasure.
Now, doctor, when it comes to COVID-19, what are you seeing at your clinic right now? Are COVID patients coming in? Are they young or old?
Well, first of all, internal medicine, I spend a lot of time with older people with more complicated problems. And my personal patients have all been vaccinated, and they're working very hard to be cautious because they are quite aware. We've explained to them the risk of this.
Now, I know school is about to start very soon, and you work with, you say, older patients. What
Yes.
do you expect it to be like after school starts and the children are coming home and mingling with the adults?
Well, this is a real big problem because the transmission of the virus can still happen, especially with some of the variants, even with vaccination. So especially the deep type that we've seen, we're telling our patients to be very cautious. Children can bring it home to the family, and the hardest place to prevent it has been the family in my experience here. People don't expect to get infection from their loved ones, and they want to be around them, so it is a trickier time for them. So we may see a change in the frequency.
Now, with the older patients that you see, what sort of, I guess, symptoms do they usually present with when they come in?
Well, with this virus can be lots of things. I mean, this is a complicated presentation. You know, the most characteristic one we've had is the loss of smell and taste. That, for some reason, has correlated really well with the virus. But they can come in for almost anything, and some of them don't even have symptoms, can have the virus.
Now, as the number of cases continue to climb here in Central Texas, what can people really do to protect themselves, especially if they have kids that are going back to school?
Well, first is vaccinate. That is the key to this. Second is use the common sense you have and what we've learned. Wear a mask. Be cautious with people you don't know who could be infected. If the population vaccinates itself, we should see a decline in the virus. If people just take that extra precaution when they go, especially if they go out, wear a mask, and be cautious in particularly indoor settings. That should help really curb the virus spread. With schools, I mean, it's different, but you can still be cautious at home and continue the same safety.
All right, Dr. David Gray with Austin Regional Clinic, thank you so much for your time.
Oh, my
I really
pleasure.
appreciate it.
Yeah, thank you.